The number one mistake people make is not having a clear enough standard of pressure. It's very important that you don't start your pressure calibration where you find the pulse. Whether you're doing superficial deep, superficial moderate deep, or in the case of the system that I use, we're really looking for 15 different levels of pressure. It's extremely important that you have a standard in your mind that you're applying to everybody. Of course, there are relative differences, but if you begin taking the pulse where you feel it and start your pressure calibration there, you're really going to skew the whole diagnosis. And I see a lot of people do that, and then they miss the entire upper level aspects of the pulse. Number two, not having a clear enough sense in our mind of the definition of the pulse. This is about naming things. It's very powerful to be able to name the pulse, to be able to really clearly articulate its definition. It's a bit like going birding and having a very clear sense, a very clear definition of what is a cardinal, what is a blue jay, and so on. Then you go out into the woods and you see many, many more birds. It's exactly the same with the pulse. The clearer our definitions are, the more capable we are of finding those pulses. We have to name them to be able to find them. The third major mistake that people make is to not spend enough time on the pulse. Sometimes the image or quality that's most important doesn't reveal itself until the 20th or 30th beat. So when we take the pulse too quickly, we miss the opportunity to see what's really going on. It's a meditative process. It's an important skill development to be able to just sit calmly in one place on the pulse with one amount of pressure and allow the pulse to reveal itself to us.